Hi, my name is Sierra, and today I will be talking about the impact of race on the prevalence of HIV and AIDS on Hispanics. So, some demographics and population characteristics. Hispanic self-identification varies across immigrant generations. Among the foreign-born from Latin America, nearly all self-identify as Hispanic, but by the fourth generation, only half of people with Hispanic heritage in the U.S. self-identify as Hispanic. The U.S. Hispanic population reached a record 60.6 million in 2019, which upped 930,000 over the previous year, and up from 50.7 million in 2010, according to newly released U.S. Census Bureau population estimates. To the left of the screen, I provided a graph that showed just how significant the increase of the U.S. Hispanic population was. Many of the health disparities documented in the U.S. are linked to access to care barriers and other socioeconomic determinants of health. There is not enough sufficient information to understand how the interaction between individual physiological, genetic, epigenetic variability, comorbidities, and other health determinants differentially affect members of most culturally and racially diverse communities in the United States, which includes Hispanic and Latino communities. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information to make appropriate health decisions. According to the most recent National Assessment of Adult Literacy, approximately 66% of Hispanics have basic or below basic health literacy skills. This is important because that's over half the Hispanic population. Trained bilingual research assistants conducted a semi-structured interview with each participant that lasted approximately 60 minutes for patients categorized as having inadequate health literacy according to the short test of functional health literacy in adults. Social determinants of health are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. Hispanics are overrepresented in reported cases of acquired immunodeficiency syndrome, which is twice their proportion of the population, and that their rate of infection by human immunodeficiency virus is 3 times higher than among non-Hispanic whites. Hispanics are disproportionately affected by poor conditions of daily life shaped by structural and social position factors, which are microeconomics, cultural values, income, education, occupation, and social support systems, including health services. HIV is a sexually transmitted infection. It can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. The graph that I provided shows the percentages of those that are diagnosed, which is 84%. 59% of those diagnosed received care, 49% retained in care, and then 50% virally suppressed. In the absence of a medical cure for AIDS, HIV-infected individuals may seek alternative treatments that are consistent with their cultural and social beliefs. A paper I read examined beliefs about and the use of folk healing practices by HIV-infected Hispanics receiving care at an HIV/AIDS clinic in inner city, New Jersey. Interviews were conducted with 58 male and 18 female HIV-infected Hispanics between the ages of 23 and 55, which they were primarily of Puerto Rican origin. The majority of the respondents believed in good and evil spirits. Among the 56 believers, 48 stated that the spirits had a casual role in their infection, either alone or in conjunction with the AIDS virus. 2/3 of the respondents engaged in folk healing, spiritualism, and or Santeria. The main desired outcomes of folk healing included physical relief, spiritual relief, and protection from evil. A number of respondents stated that they hoped to effect a cure by engaging in folk healing. These results indicate that the healthcare professionals treating HIV-positive Hispanics should be aware of the prevalence of folk beliefs and alternative healing practices in this population. To be successful with Hispanics, for example, health communication messages need to consider the following core Hispanic values. The first one is familialism, the significance of the family to the individual. The next one is collectivism, which is the importance of friends and extended family in helping to solve problems. The third one is simpatia, the need for smooth interpersonal relationships in which criticism and confrontation are discouraged. The next one is personalism, the preference for the relationship with the members of the in-group. Respeto is the need to maintain one's personal integrity and allow for face-saving strategies. And then the last one is power distance, which is certain persons such as the powerful, the elderly, and the educated should be treated with special deference. The prevalence of HIV and AIDS is high within Hispanics due to the numbers of adults having reported a low HL. They are also more susceptible to HIV and AIDS because Hispanics are disproportionately affected by the conditions of poor daily life, shaped by structural and social position factors. And these are the resources that I used to conduct this research. Thank you for listening.